Hello, everyone. I'm Jeffrey Pacheco. This is Group 1 presenting our Mental Health Disparities Project. My disparity is on mental health facts for Hispanics. Hispanic groups face barriers regarding mental health because of immigration and shifts in population. Ethnic and racial diversities in the U.S. continues to increase every day. Due to decreased utilization rates and inadequate or delayed mental health services, the accessibility of inadequate mental health care to Hispanics has been troubled by challenge after challenge. Hispanics are currently the biggest and fastest growing ethnic minority. Something needs to be done to help. Hispanics deal with the inadequate, delayed, and lower quality access to mental health care. Some potential influences on mental health burdens are low education achievements, low income, and unemployment. There are systems and patient factors that contribute to the inadequate mental health care that U.S. Hispanics get. Socioeconomic status, their language proficiency, and citizenship status are a few examples of patient factors that restrict access to care. Language is a major concern, as almost 3 out of 10 Hispanics can say they have trouble speaking with their healthcare professionals. Some improvements need for Hispanics populations are better access to healthcare, the utilization of care, and the quality of care they receive. My references can be found at the end of the presentation. Thank you so much.
Hi everyone, I'm Chelsea. I was in charge to research the disparities in mental health for women. So, according to delve deeper into this issue, I will discuss depression and why women are more susceptible to depression. So, women are twice as likely to have a long life prevalence of a mood, anxiety, and trauma-related stress disorder than men. 12 million women experience depression each year in the US. 1 out of 8 women will develop depression in their lifetime, and women aged 25 to 44 are most affected. Premenstrual dysphoric disorder and postpartum depression are forms of depression only affecting women. So what are the factors that contribute to this? Differences in socialization. Girls are made to conform to feminine gender roles. Girls being socialized from a young age, that their value is tied to their physical appearance, things like those, etc. So women's social standing. So the way society intentionally or unintentionally places women due to longstanding beliefs, such as the belief that women are inferior, less smart, less capable, etc. Puberty is a very tumultuous time for everyone, but women, due to sexual dimorphism and developing more, are susceptible to more negative experiences, causing stress and thus leading to the development of depression, etc. Instances of gendered violence, domestic violence, longstanding abuse from a married partner. Anxiety in women. Anxiety is the most common psychological disorder diagnosed, yet more women have a higher likelihood to develop anxiety in their lifetime than men. Women are twice as likely than men to experience childhood sexual abuse. Women experience assault 10 times the rate of men during adulthood, although not negating that men also experience sexual assault, but women experience it at a higher rate. Women are also more reactive to stress. As for PTSD, the lifetime prevalence of PTSD is a 10 to 12% for women. Factors that contribute: exposure to high impact trauma, such as sexual abuse and childhood trauma. Eating disorders is also a very gendered disorder affecting women more than men. 0.3 to 0.4% of women will suffer from anorexia. 3.5% of women have experienced binge eating disorder in their lifetime, and 1.5% of women have also experienced bulimia in their lifetime. Factors that contribute to eating disorders is sociocultural, so an emphasis on thinness and the equating thinness with beauty. So, what are the barriers that women face that prevent them from receiving help? Although women are more likely to reach out for help, there are still many barriers present that prevent them from receiving this much needed help. Things like internalized stigma, which is the feeling of shame associated when it comes to reaching out for help that prevents someone from getting help. According to an article by the Psychiatric Times, stigma for reaching out / receiving mental health care is one of the biggest barriers for women of color. Literacy in mental health, so knowing about mental health disorders and the beliefs associated with them. Women lack comprehensive mental health literacy, regardless of ethnicity, race, and socioeconomic factors. Mental health literacy is an important factor that leads individuals to seek out for help. Also, socioeconomic status. Socioeconomic status correlates with women's health outcomes. There's a link between lower socioeconomic status and negative psychological health outcomes for women, according to an American Psychiatric Association fact sheet. Women are also more likely to be in poverty than men, and as a result, they are less likely to stay in treatment or even seek out help. So, a great intervention for women to combat certain mental health symptoms is actually mindfulness meditation. Women engage and practice mindfulness meditation more than men. Mindfulness meditation has shown to be beneficial for depression in women, and a study from Frontier Psychology suggested that women benefit more than men from mindfulness meditation as it reduces negative affect. So now Mariana is going to be presenting the disparities in socioeconomic inequalities between genders.
Hello, everyone. My name is Mariana. My disparity is on disparities in socioeconomic inequalities between genders. So, how are women more affected than men? According to the American Psychological Association, poverty rates for all groups of adult women were a lot higher in comparison to their male counterparts. Why, we may ask? This is due to the fact that women are paid less than men, even when they have the same qualifications and work the same hours. It is nonetheless evident that over time, there has been little progress made toward greater equality in payment between males and females. So, how does inequality in socioeconomic status mentally affect women? Numerous studies conducted under the direction of research psychologists have revealed that women's poverty and debt increase their risk of depression, anxiety, and suicide. A research study done by the National Institutes of Health indicated that female income was less than the matched male counterpart. Odds of both disorders were significantly higher among women versus men. Health issues that may arise in women due to poverty include high cortisol levels, developing chronic stress, obesity, diabetes, developing cardiac disease, and cancer. Despite that it is not within our power to fix the disparity in socioeconomic standing that exists between men and women, what can we do in order to obtain mindful relaxation during tough times? Firstly, practicing mindful meditation may not help solve the issues within pay gaps, poverty, etc., but it may help decrease the risk of health issues. To decrease our risk of developing any health issues, it is essential to practice mindful meditation. According to the National Institutes of Health, the most frequently reported positive benefits were a sense of increased awareness, self-acceptance, self-empowerment, non-reactivity, and self-care, as well as decreased distress, which was reported when men and women practiced meditating.
Hi, my name is Emma, and my disparity is the LGBTQ community. In the LGBTQ community, members experience mental health issues at disproportional amounts when compared to their heterosexual populations. Gay and lesbian members in the community show 4.4% of the population report suicidal thoughts, and transgender members report 30.8%. This is disproportional, as only about 2.3% of heterosexual individuals report considering suicide. Common disorders that are often seen in members of the LGBTQ community are depression, anxiety, and substance abuse. LGBTQ members are also more likely to experience violence, and violence can be a trigger for mental health and behavioral issues. LGBTQ members are about 1.5 to 2 times more likely to experience a mood or anxiety disorder. There is a stigma placed on members of the LGBTQ community due to the breaking of what's considered social morals, and this also contributes to mental health issues in this community. However, LGBTQ members are shown to have a greater use of mental health assistance, so there is chance for these statistics to change.
Hi, I'm Danielle, and I did the mental health disparities on Appalachian communities. Appalachian communities typically work in mines and in areas that are pretty much going to produce some type of trauma. Historic trauma plays a part because they're ducking blows, absorbing blows, giving blows, and these would be typically in the mines and working with the dynamite and the injuries that occur with it. These require medication, which can lead to addictions to opioids. And then if they cannot acquire an opioid, they will become addicted to methamphetamines. Alcohol is also another popular choice to help deal with the pain. This leads into consequences such as family violence. You have unemployment, inadequate housing, economic loss, which also play a part in the struggles that the Appalachian communities deal with, which affect their mental health. More than 50% of babies in the region's area will suffer from neonatal abstinence syndrome because the mothers have been addicted to a methamphetamine or an opioid. Families tend to become resistant to change and encourage behavior that increase family harmony. You have maternal overprotection, which can lead to problematic behavior in children, which also goes into the family violence and the historic trauma. Women are bound by the more traditional roles, so they don't have role models that they can necessarily look up into. They aren't really able to find jobs, so they're kind of like stuck in a place where it can be very depressing, which leads into some of the more common mental health disorders that the Appalachian communities deal with, which are school phobia, overly dependent personality disorders, hysterical personality disorders, and elective mutism. There's no shortage of judgment for any of these diseases. Men can be seen as overly dependent on their mothers or their wives due to the traditional role placed in women. There is a lack of integration into the social norms, which create personality attributes and the values in the low income or low status individuals. So they are seen as lower than anybody else in the Appalachian community. Women who are pregnant and want to become clean for their baby will go to Suboxone clinics, and the clinics will give them the impression that switching to Suboxone will be harmless to their growing babies, but in fact, it may be less harmful than the drugs that they were addicted to, but it is not harmless. So whether women or parents who are addicted whether they are addicted or are working on to becoming clean, they are seen as caring more about their addiction than their children or their families. And then they aren't really necessarily aware of the effects that happen when giving birth, that their babies are going to have to be weaned off of whatever medication that they were taking.
Okay, good afternoon. My name is Maria Villegas. The disparity that I have on is American Indian and Alaskan Native populations. So next slide, please. So I want to start off first with the land acknowledgement. This is traditional, especially, so I currently work on the reservation, and this is how we always start our meetings, especially if we're not from the lands. So I just wanted to bring this practice here as well. So I want to acknowledge the Payacuichon people of Pachanga Band of Luceño Indians, La Jolla Band of Luceño Indians, Paula Band of Mission Indians, their Cupeño and Luceño, Palma Band of Luceño Indians, Rincon Tribe of Luceño Indians, San Luis Rey Band of Luceño Indians, and Saboba Band of Luceño Indians. And with that being said, I want to thank you for allowing us to reside on the land in which we live on and continue to find growth within our studies here at MSJC. And I want to acknowledge all the Indigenous people who currently work in the field of mental health and other human services and revitalizing the Native American culture and help promote healing for the next generations to come. Next slide, please. So here's just a really nice quote that kind of spoke to me and that kind of relates to the presentation. It says, "Our ancestors knew that healing comes in cycles and circles. One generation carries a pain so that the next can live and heal. One cannot live without the other. Each is the other's hope, meaning, and strength." Next slide, please. So we kind of already discussed trauma, right, and historical trauma. So here in the Native community, we also can see intergenerational trauma as well. So when we discuss intergenerational trauma, I can't speak today. One must also think about the historical events causing the trauma, right? So historically in Indigenous populations, they have experienced severe trauma that has been passed down from generations to generations. Like for instance, relocation, right? Or another example is like the lost generation of children where children were being taken away from their families and their tribes. And with that, they were getting put into boarding schools. We actually still have a boarding school here in Paris that is no longer active in the way that it used to be. There's also been trauma in land disposition, loss of spiritual practices, and then loss of language as well. So some of the symptoms that come with intergenerational trauma may vary depending on the events and the families that have experienced this kind of trauma. So it can either lead to it feeling like physical, emotional, or behaviorally. Next slide, please. So the effects of intergenerational trauma. The effects of intergenerational trauma and unresolved historical grief can manifest as depression, anxiety, PTSD, and substance abuse if they're not properly addressed and identified. Or other traumatic events that may lead to intergenerational trauma include like incarceration, divorce, alcohol, domestic violence, and child abuse. So when I worked on the reservation in the clinic, I worked in their social service department. I worked with women that were expecting mothers, but they were also using drugs. So with that, I taught them what some of us would think is basic, right? How to clean a baby's mouth, how to change a diaper. Because the loss of generation, some of these women didn't know how to do these things, right? It was never taught by like their grandmother, was never taught to them, from a mother. And these are things that get passed down. So that's just like an example. Next slide, please. Okay, so factors that influence the mental health. So the cultural impacts. Indigenous communities need access to cultural, like competent healthcare. So also like there needs to be like traditional practices incorporated when they are receiving care. And I'll talk a little bit more about that. There's also social impacts. So there's also like discrimination that they do face a lot. Um, and along with also like they have like physical and like mental impacts as well. And Indigenous people also face unique challenges related to their identity, such as like intergenerational trauma and colonism, right? Oops. Can you go back a slide, please? Oh no, sorry. That was my fault. Yeah, there we go. And then economic factors. Indigenous people often lack access to adequate healthcare. So on the reservation, most of the time it's far away from like the city, right? So they are far away from like healthcare and all that access. Nowadays, we do have like the online healthcare. So it's just the thing with like Native American communities, it kind of like depends on the tribe, right? On their economic factors. So some tribes, they might be like getting their money from casinos, right? And others don't have those type of resources. Next slide, please. So Native Americans, there are ages 15 to 24. They are the second leading cause of death is suicide, right? Which is pretty high. There's also a 4.8 to a 4.6 lifetime prevalence of PTSD, and a 94% of youth meet the criteria for substance use disorder. So here in the little graph, you can see that there's 1.3% of the US population identify as being Native American or Alaskan Native, right? So of those, over 19 reported having a mental illness in the past year. So that is over 827,000 people, which can fill, as you can see, a baseball stadium twice. So that's pretty high, right? So we can go ahead and go to the next slide. So some of the treatments that are like that can be applied, right, culturally, is like plant medicine. So something that they can do is, incorporate smudging, like before they start like therapy or something like that. So that you can either do it with like sage or cedar or whatever is traditional to the area. Again, to each tribe, it might be a little bit different. Sweat lodges as well. It's something that you can also be incorporated, especially in the use of substance disorders. It's usually a common practice to do sweat lodge. But then again, you have to know the traditions and the practices of each tribe, because some tribes only do sweat lodge in the winter, right? While others do it anytime. So it's also being mindful of that. And then also bird singing or drum circles and dancing can be also healing. But then again, you have to be respectful and also be aware, like, can women participate or men participate in this, right? So it's also like, again, being mindful of the tribe that's being serviced. And another way that's healing is through prayer. like praying to the creator and storytelling. And that's it for me.
Hi, my name is Felicia, and I'm going to be discussing mental health disparities on refugees, asylum seekers, and survivors of forced displacement. So just some quick facts on this. There is 68.5 million people that are displaced globally due to conflict, violence, and human rights abuse. Out of the 68.5 million, 28.5 million are refugees and asylum seekers who have fled their own country and are living in transition camps and detention centers, most of which do not go back to their country due to the large amount of violence and the takeover from others. Research has stated that there are 30% of individuals that do have PTSD and depression due to the heavy trauma and the violence that they have seen. So one of the main strategies for them, since there's not access to healthcare or mental health care, is self-help, looking at one another and leaning on each other during that difficult time. Some of the methods that they do practice are the religious prayers and beliefs. A lot of it is through religion. They form prayer groups. A lot of religious beliefs just for the children and mainly the mothers who take part in the groups. Social support is also big in the detention centers and camps. Speaking to each other and staying connected with each other is huge for them, especially when taking care of families and leaning on someone. Networking is also a big part of it. So people come in and out of there every day. They get to meet new people and also people that have found resources for everybody. Everybody's in a different situation. So when meeting others from different areas, they have other options of resources and they can get in touch with others that are higher up for healthcare. So support that actually works for them. Physical activity and playing sports and dancing is one thing that helps with the kids. Faith and spirituality, again, that's forming groups together and just believing in a higher power.